Then we have type 3 hypersensitivity. This one involves immune complex. This is an immune complex mediated hypersensitivity. So here we are having an antigen antibody complex that is forming. And once you have an antigen antibody complex that is forming, then of course it will lead to tissue damage. That leads to tissue damage. So what is the mechanism here? There is complement activation. Complement, of course, is activated, and once complement is activated, it attracts polymorphonuclear nucleosides, and these leukocytes, of course, are going to release mediators, and these mediators, of course, are able to again then damage the environment where they are. That leads, of course, to platelet aggregation, and once the platelet aggregates, then of course there's going to be marked damages within the site of injury. Between say 3 to 8 hours, you're going to see edema, you're going to see erythema, you're going to see lots and lots of infiltration of polymorphs, that is neutrophils, at the site of injury. That is what is happening. Here is just an antibody combining with antigen, so to form a complex, and once that happens, then of course other mediators are going to be recruited at the site of injury, and that of course activates complement, that activates platelet aggregation, and the site of injury, of course, you're starting to see signs of inflammation at the site of injury. So examples of conditions that are triggered by this would include things like the farmer's lung, pigeon fanciers disease, pulmonary aspergillosis. These are antigens that you can inhale these antigens, and they lead to high antibody levels in the body because there's just the formation of an immune complex that is antibody antigen, and this, of course, are triggering these reactions. And these reactions are also common in some diseases such as leprosy, find diseases like syphilis, they are there. Conditions like autoimmune diseases like rheumatoid arthritis, you find these reactions occur also. And so these immune complexes are formed, and once they are formed, they are able then to cause damages at the site of injury because they cause an inflammatory response at that particular point. This may be so affect even things like the kidneys, it can affect joints, it can affect skin, it can affect the choroid plexus where the, of course, where the arteries are meeting. That this is ultimately what kills individuals who have rheumatoid arthritis. These damages of the kidney, joints, skin, and choroid plexus. Unfortunately, this is what usually damages individuals who have rheumatoid arthritis, those complexes as they form. So other diseases, of course, that are related to type 3 hypersensitivity are serum sickness, glomerulonephritis, of course, some neurological conditions like SLE. SLE, of course, is an autoimmune disease. Vasculitis, especially in individuals with hepatitis B. Hemorrhagic shock for people who have dengue fever. It's just as a result of the immune complexes forming. And once the immune complexes form, that is the immune complex resulting antibody reaction, inflammatory responses are going to take place at the site, and that, of course, causes damage.